Okay, so we're going to talk about dissociative disorders. Now, this is where we start to get into mental health disorders that are pretty rare, but it's still important to know what to expect and how to care for these clients. So the textbook definition of dissociative disorders is a group of disorders in which conscious awareness is separated from previous thoughts, memories, or feelings. So the best way to explain this, have you ever been, driving home from school or from work, and then suddenly you're home and you can't remember how you got there or any specific turns you took? Those moments became disconnected from your conscious awareness. You were present, you were still doing the driving, you were awake, but you weren't really conscious of it, okay? So here's our client. And here is all of their conscious existence, right? Their memories, their thoughts, their feelings. Okay, this is everything that kind of makes them who they are and kind of makes up what they do on a daily basis. So when they have a dissociative episode and they dissociate, it's like it completely cuts off their conscious connection to this, like a big brick wall. They now just can't consciously access all of these things that made them who they were. So you may actually see a complete loss of memory or a complete change in their identity. So it's thought to be kind of an extreme coping mechanism. So some form of extreme trauma occurred, and the only way that their mind can come up with on how to cope with it is to completely dissociate. So think about how traumatic something has to be for your brain to unconsciously dissociate from with reality. So just think about how traumatic something would have to be for your brain to unconsciously dissociate from reality. Like you have to get away from it. You have to completely disconnect from the situation. So keep that in mind because these patients often have some serious trauma in their lives. So there's 4 main types, so we want you to understand just the basic differences between them. Again, this is very rare, but it's important that you understand what your clients are going through, kind of how to help them. So the first is dissociative identity disorder. In this case, the client has 2 or more distinct personalities. So they'll kind of break from the reality of who they are, and they have another personality that they jump into that has different thoughts, feelings, and memories, okay? Dissociative amnesia is when they are unable to recall important information. So they have a memory loss and they can't recall, maybe who they are, or they can't remember their family because of this extreme anxiety. It's just like the amnesia that you would see with a head injury, except it's because of emotional trauma as opposed to physical trauma. The next one is dissociative fugue. Now, this is when they develop an entirely new identity. So they have a new name, a new story, new passions, new everything. They have absolutely no memory of who they used to be, and this new identity becomes this coping mechanism. But more than that, some clients will literally leave their home. They will move away from their family, and literally start an entirely new life because consciously they truly believe that they are now this new person and they have no connection, emotional or otherwise, to their old life, okay? Finally, depersonalization disorder, also called derealization. This is when a client feels like they're kind of outside of their own body. So de-person, they're outside of their own person. Outside of their body, they don't recognize themselves in a mirror. They feel like they're kind of in a foggy, dreamlike world. Their consciousness has disconnected from their physical body. So if you check out the patient story attached to this lesson, that gentleman talks about what this is like for him and kind of what he experiences. So when we start to talk about interventions for mental health disorders, again, you're going to start to see some patterns develop. Some of these apply to all disorders. Some of them are very specific. Normally, we try not to give you a list of dozens of interventions, but in the case of mental health, many of them are safety related because the client's conscious and rational thought may not be intact. So we always, always, always put safety first. So make sure that they don't have any plans to harm themselves or others, and, establish that trust and rapport with them. We also want to orient them to reality as best we can. Remember that this disconnect and possibly new personality or new identity is very real to them. So we don't want to challenge too much, but we do try to keep them in reality. We also encourage them to explore their feelings and thoughts about the situation, and we focus on their strengths as opposed to focusing on their difficulties or their struggles or what they're not getting right. We don't want to focus on that. We always want to start with simple tasks or simple requests and kind of move to the more complex ones as they're able. We want to promote healthy coping mechanisms and compliance with their therapy and their meds if they're on them. But the big thing is, just being consistent with their meds, being consistent with their treatments. It's going to be the most helpful thing for their recovery. And then, of course, we always want to involve the support system if they have it and make sure that they have what they need. As with other mental health disorders, priority nursing concepts are safety, coping, and mood affect. We want to assess for self-harm, make sure we're giving them healthy coping mechanisms, and always put safety first. So let's just recap quickly. Dissociative disorders are when a client's conscious awareness is disconnected from their past thoughts, memories, and feelings. They're disconnected from the reality of who they were. So usually this is an extreme coping mechanism for some sort of extreme anxiety or traumatic experience. There's 4 types: dissociative identity disorder, dissociative amnesia, dissociative fugue, and depersonalization or derealization disorder. And we want to make sure with these clients, we always establish trust and rapport. We reorient them and try to keep them in reality as much as possible. We encourage expression of feelings. We validate their feelings, and we always support them with small tasks and healthy coping mechanisms, plus educating their support system. And then, as always, safety first, always do a self-harm assessment and ask if they have a plan, which we'll talk about more in the suicidal behaviors lesson. So that's it for dissociative disorders. Make sure you check out all of the resources attached to this lesson, especially the patient stories. Now go out and be your best selves today. And as always, happy nursing.